Hey guys, Dr. Ray Mohar, Head Professional Motion Physical Therapy. Just got this message. Hey, I have a friend, or let's just say that I have a patient that's asking about the difference between tendonitis and something a little more substantial or emergent, like a stress fracture. Really good question. There's a couple of things I'd like to go ahead and state. First and foremost, go to your provider, PCP, primary care physician. If it was involving a traumatic episode or some type of repetitive trauma, you could definitely go ahead and have some issues with bone types of things, stress fracture being one of them, or contusion, or something a little bit more substantial than that. But definitely go see a provider. But when we see him, there's a couple things that we look at. First and foremost, is there a issue with any of the bony prominence of that injury? We see in specific areas of the body, one of which is either the knee or the ankle or different parts of the foot or the shin, or even a stress fracture within the hip. All I've seen them from either from repetitive trauma or from some other type of contusion or an insult or some type of horseplay. All of which is I always ask the pertinent questions. How did you do it? What was the circumstances with regards to the injury? Did you have it one day? Did you wake up one day and have pain onto the outside portion of your foot? Do you have a hard time weight bearing on it? Does it only hurt during running activities? Does it increase in pain or swelling after the run, not during the run? All these things are really pertinent information. And to really ascertain whether it is a bony contusion or a hematoma or something. Unfortunately, our teenagers are really hard to go and get information from, so we have to go ahead and do a little bit digging. Sometimes there's a bit of, like I said, a bit of horseplay associated with the issue that they may have or coming in with. So that's definitely something we have to go and look at a little bit more specifically. But location, anatomy, knowing what hurts at what type of the activity, which movement increases the pain. These are the types of things that we look at specifically to ascertain whether that's a problem. As far as giving you certain types of clues, well, first thing is if you have a lot of pain, go and see a provider. Okay, I don't expect my information to go. This is not meant to diagnose anyone. Let me make sure that's perfectly clear. It's not meant to go ahead and give me an information that you can go and help treat on your own or ask Dr. Google. Thank you, Browns, for that little tidbit. But anyway, those are the types of things that I would look at. Now, generally speaking, if you rest it and ice it, hopefully within 2 weeks, if it doesn't go away, go see someone else. Go see a provider, a physical therapist, or your primary care physician, to go and ascertain this information for you. And then hopefully that individual will go ahead and give you the right guidance to take. Either it's maybe immobilization or a bit of soft tissue work within that particular junction of the anatomy. Then it just really depends. I know that's a politician type of answer, but it really does. Every injury is unique in its own way and affects individuals differently. ACL injuries, PCL injuries, MCL, they all respond a little bit differently, but they have their own different variables that we look for. Instability being one of them if we're thinking in instability within the ligaments. But that's kind of going off the beaten track with regards to, how can you go ahead and figure out if it's a tendonitis or if it's a contusion or a stress fracture. And again, there's a lot of things that we look at. First of all, if it's a younger individual, it's really hard to ascertain whether it is a fracture just because of maybe growth plates around this area. Harder for a physician or a PA to go ahead and actually ascertain that information from you if they're not well versed in that. Tendonitis can go ahead and become very, very problematic. They can go and carry on for many, many months, sometimes even years, depending upon if it's been calcified or not. But again, I hate to go ahead and give a specific answer to any of these things just because it works different for a lot of different people. There are specific tests that we do for possible stress fractures. There's specific tests that we do for possible tendonitis issues. First and foremost, palpation. If it's tender along that area where we know that a known junction is with the tendon, and we know that more than likely, based upon the activity level of that individual, that would be one of the things that we look at, either if it's a shoulder, or if it's a knee, or if it's an ankle. These things are very important to go ahead and look at, and hopefully you'll get some information from this video. And I'm mumbling right now. I'll let you guys go, and I'm tired, I'm hungry, I'm gonna go. All right, see you guys.